Hello, Professor. We are Group 19. I'm Ayşegül Ebrar Öksüz, and my friends are Binnur Kaya, Elif Gök, and Tuğçe Avşar. Today, we are going to present you sarcopenia data analysis report. And in this study, 59 patients with rheumatoid arthritis were followed in the Department of Physical Medicine and Rehabilitation. And I will start with presence of sarcopenia. And in this table, we can see that frequency of no sarcopenia is 44 patients with 74.6%. And potential sarcopenia is seen in 15 patients with 25.4%. And here we can see the bar chart of the same data. Then I'll continue with age distributions. Here we can see different age groups and frequencies. Most frequent one is seen in age 50. And this is the bar chart of age distributions. Here we can see again 50 is the most frequent one. This one is the box plot of age distribution. And lastly, this is the histogram of age distribution. Then I'll examine the smoking status of patients with rheumatoid arthritis. In this table, as we can see, the highest frequency with 38 patients don't smoke, and its percentage is 64.4. And 7 patients quitted smoking, and 14 patients are still smoking. And this is the bar chart of the smoking distribution again.
I will talk about body mass index. Here, this frequency table shows the distribution of body mass index of patients with rheumatoid arthritis by sarcopenia status. The mean BMI 30.47 indicates that averagely patients are at overweight category. This suggests that potential risks that comorbid factors related to obesity, such as cardiovascular risks, which can create issues in rheumatoid arthritis management. The highest number of patients is seen at BMI value of 28.6. The highest frequency is seen in the BMI range of 28 to 30. These values are classified as overweight. Among rheumatoid arthritis patients, there are more overweight individuals than those of normal weight. Around 28.5, this means half of the sarcopenic patients have a BMI below 28.5 and the others half are above. The box spans from 27 to 33.5, indicating the middle of 50% of patients fall in this range. This supports the concept of sarcopenic obesity, a condition where individuals may appear overweight or obese by BMI but still have significant muscle loss. Patients with higher BMI may still have reduced muscle mass function, highlighting the need for additional assessments tools like muscle strength. In histogram, the mean BMI is 30.47, standard deviation is 5.249, and N is 59 patients. Most patients fall between 25 and 35, clustering around the 30 mark. The highest bar is around 29 to 30, with nearly 20 patients in this bin alone. This shows a high concentration of individuals just under the obesity threshold. Despite the high average, the wide standard deviation, which is 5.25, indicates substantial variability. And I will continue with Schimmer test results. The Schimmer test measures tear production. Patients are categorized into those with tear production below and above 5 mm, which distinguishes severe dry eye from less severe or no dry eye. The frequency in smaller than 5 mm is significant number of patients, fall in this category, and the remaining patients fall into bigger than 5 millimeters. Around 47 patients fall into smaller than 5 millimeter category. This indicates a very high prevalence of dry eye among the sampled rheumatoid arthritis patients. Only about 10 patients had shimmer test results bigger than 5 millimeter, indicating relatively normal tear function. The chart strongly suggests that reduced tear production is common in patients with rheumatoid arthritis. And I will continue with oral symptoms. This table presents a binary classification of rheumatoid arthritis patients based on whether they report oral symptoms, including dryness, soreness, and difficulty swallowing. A significant proportion of the cohort is affected by these symptoms, suggesting that oral problems are a common and clinically relevant concern in this population. By splitting the data into yes or no categories, the table effectively illustrates the overall burden of oral manifestations in rheumatoid arthritis, drawing attention to the need for integrated oral health monitoring in patient care. And I will continue with by charts 6. About 49 patients reported the presence of oral symptoms. This is the majority of the study population, indicating that oral symptoms are very common in individuals with rheumatoid arthritis. Only around 10 patients reported no oral symptoms. This shows that only a small minority of rheumatoid arthritis patients are unaffected orally. These findings emphasize the need for oral health screening and management in rheumatoid arthritis care.
Hi, now I will continue with VAS score. And when we look at this table, the mean VAS score was 4.71, indicates that on average, patients experience moderate pain, underscoring the chronic pain burden associated with rheumatoid arthritis. The distribution of scores reveals that while many patients report mild to moderate pain, a notable proportion experiences severe to very severe pain. The variability emphasizes the importance of personalized pain management approach tailored to individual patients' needs. And in this bar chart, compares the distributions of patients across various VAS pain scores for both non-sarcopenia and potential sarcopenia. Lower pain levels, which are 0 to 2, are more frequently observed among patients without sarcopenia, suggesting a possible protective association. Moderate pain levels, which includes 3 to 5, remain more common in the no-sarcopenia group, although the differences between the two groups narrows in this range. And in the third group, severe pain levels, which are 6 to 8, appears to be similarly distributed across both groups, indicating that sarcopenia may be associated with increased pain, but this relationship becomes less distinct at moderate to high pain levels. And in fourth group, very severe pain, which are 9 to 10, is notably more prevalent in the potential sarcopenia group, suggesting a stronger association between high pain intensity and the presence of potential sarcopenia. And here is the box plot analysis. The box plot comparing VAS scores between groups reveals that patients with potential sarcopenia report higher pain levels overall. The median VAS score is notably higher in the potential sarcopenia group, suggesting that these patients experience greater baseline pain compared to those without sarcopenia. Additionally, the interquartile range may be wider in the sarcopenia group, indicating greater variability in pain experiences within this population. These findings highlight the importance of target pain management strategies for patients with sarcopenia. Approach should not only focus on pain relief, but also incorporate interventions that support muscle health and physical function, addressing the underlying condition holistically. And here, the histogram of VAS score appears fairly uniform, with moderate pain levels being the most frequently reported. The mean VAS score was 4.71, while the mode is approximately 3, indicating a slight skew toward lower pain levels. Scores span the entire range from 0 to 10, reflecting the broad variability in pain experiences among patients. The uniform distribution suggests that pain management is a critical component of care for all patients with rheumatoid arthritis, regardless of sarcopenia status. The considerable proportion of patients reporting high pain levels, from 6 to 10, highlights the ongoing needs for robust and effective pain relief interventions. Given the wide variation in pain intensity, individualized pain management strategies are essential to adequately address patient-specific needs and quality of life. And I will continue with hand grip test results. The mean hand grip strength of 20.51 kilogram provides an important indicator of overall muscle function among patients, an essential factor for maintaining daily activities and ensuring quality of life. A closer look at the distribution reveals 20% of patients have hand grip strength below 15 kilograms, suggesting muscle weakness and potential functional limitations, and 50% fall within the moderate range, which are 15 to 25 kilograms, indicating average muscle function, and 30% demonstrate hand grip strength greater than 25 kilogram, reflecting relatively good muscle strength. These findings underscore the heterogeneity in muscle function among patients and highlight the need for individualized interventions, particularly for those with reduced strength, to preserve independence and prevent further decline. And in this bar chart, individuals with hand grip strength below 15 kilograms are more likely to exhibit characteristics associated with reduced muscle function and potential muscle deterioration. And in the 15 to 25 kilogram range, muscle strength appears to be moderate, with a relatively balanced distribution, though there is still a slightly tendency towards better function status, and those with hand grip strength above 25 kilogram generally demonstrate strong muscle function, which may be seen as a protective factor against declines in physical performance and overall muscle health. And in this box plot analysis reveals that patients classified as having potential sarcopenia tend to have lower hand grip strength compared to those in non-sarcopenia group. Additionally, the interquartile range is narrower for the potential sarcopenia group, indicating less variability in hand grip strength. Most patients in this group considerably exhibit reduced muscle functions. These findings reinforce the established link between sarcopenia and diminished muscle strength, a core diagnostic criterion for the condition. And for clinical implication, target interventions aimed at improving muscle strength, such as resistance training, nutritional support, or physical therapy, may be particularly beneficial for patients at risk of sarcopenia. And for histogram, the histogram displays a unimodal distribution with a peak in the 15 to 25 kilogram range, indicating that the majority of patients exhibit moderate muscle strength. And the mean hand grip strength is 20.51 kilograms, with the mode failing within the 20 to 25 kilogram range, aligning with the observed peak in the distribution. Hand grip strength values range from 6.5 to 33.6 kilogram, reflecting a broad spectrum of muscle function across the patient's population. And the concentration of values in the moderate range suggests that many patients retain a functional level of muscle strength. However, the presence of individuals at lower end of the distribution highlights a subgroup with diminished strength, which may warrant further clinical attention. This variation underscores the importance of routine muscle strength assessment and the potential need for target intervention in patients with reduced hand grip strength.
Hello, I'm Elif. I will continue with walking test results. In the walking test, the average walking speed recorded was 0.96 meter per second, reflecting the overall mobility and functional capacity of patients with rheumatoid arthritis. A breakdown of the results reveals that 25% of patients are classified as slow walkers, while 50% exhibit moderate walking speeds. The remaining 25 percent fall into the fast walkers category. The bar chart displays the frequency distribution of walking test results among patients. The data show a varied range of walking speeds from 0.1 to 1.55 meter per second. The most common walking speed is approximately 0.9 with the highest frequency. A large portion of the data clusters between 0.8 and 1.2, indicating that most patients exhibit moderate walking speeds. Fewer patients fall below 0.6 or exceed 1.4, representing slower and faster outliers. The box plot shows that patients' walking test results, reflecting reduced mobility in this patient group. The histogram shows a near normal distribution of walking speeds, peaking at 0.8 to 1 meter per second, with a mean of 0.96. I will continue with descriptive statistic of study. For the age, mean value is 56.49. Average age value is 56.5. Standard deviation is 10.8. Minimum age value is 32. Maximum age value is 82. Range between minimum and maximum age values is 50. When we look at the percentile, half of the patients' ages is under 53. For the BMI, mean is 30.4. Average mean value is 30.5. Standard deviation is 5.2. Minimum BMI value is 19.2. Maximum value is 43. Range between minimum and maximum BMI value is 23.8. In percentile, half of the patients has less than 28.9 BMI value. When we look at the VAS score, mean value is 4.71. Average value is 5. Standard deviation is 3. Minimum VAS score is 0. Maximum VAS score is 10. Range between minimum and maximum is 10. For percentile, half of the patients feels VAS score under 5. When we look at the hand grip test, mean is 20. Average is 20. Standard deviation is 5.5. Minimum hand grip test value is 6.5. Maximum value is 32.6. Range between minimum and maximum is 27.1. When we reach the walking test, mean is 0.9. Average walking test result is 1. Standard deviation is 0.25. Minimum walking test result is 0.1. Maximum result is 1.55. Range between 1.45. For percentile, half of the patients has walking test results less than 0.9. This is the end of our data analysis report. Thank you for your kind attention.